Hello everybody and welcome to Truly Heal. And today we have a very, very special guest with us, which I'm excited about because we know each other since a very long time, Dr. Pavluck, and he is well known as one of the leading experts in PEMF. And most people know that I'm very excited about PEMF in regards to cancer treatments, but also in regards to boosting health. So to meet you here at the trade show and you present a new device, I thought it's very nice if we could talk a little bit about your knowledge in PEMF, especially in regards to chronic diseases.
Chronic diseases and even cancer, we can touch on that too.
Yeah, good. So would you give us a little bit of an overview in regards to the main functions that you see are important coming from PEMF?
Well, one of the key elements missing in life on the planet today is that people generally don't have enough energy in their cells. So what we all know is that you have to have a good lifestyle. So you have to eat well or eat right. You have to exercise properly and get the right amount of exercise. You have to have the right attitude. You can't heal any chronic condition without those being in place. But they're not enough. They're necessary, but they're not sufficient.
Yeah.
Okay, what makes them work better is that you condition the cells to have a lot more energy. Right? The Earth itself, right now, today, is probably something like 20-fold different magnetic field intensity than at the peak of human evolution.
Yeah.
So as a result, our bodies are energy starved. So you can have all the right conditions set up in the body, but it's still depleted or deficient to start with. So even being born, you're being born into a world, a geophysical world, that's somewhat deficient. So
can I just come back, because a lot of people would say, why is the energy field, the magnetic field of the Earth decreasing? Is that because the hardening, the cooling of the crust?
It's probably a whole bunch of factors, and obviously it's cyclical.
Yeah.
Okay, so as the crust changes or thins, as the planet starts to slow down a little bit and its spin, there's probably a host of different factors which we don't completely understand anyway.
Yeah, certainly.
So we know that we suppose, let me put it that way, it's hypothesized that as the planet spins and the molten core inside spins at a different rate relative to the mantle, that spinning rate creates a magnetic shearing force, because the molten core produces its own magnetic fields. The spinning of the planet itself, the mantle, creates its own magnetic fields. The motion of the planet around the sun and in the universe creates its own magnetic field. The Earth's magnetic field shields the Earth from the sun. If we didn't have a magnetic field around the Earth, called the magnetosphere, which extends hundreds of thousands of miles behind us and tens of thousands of miles ahead of us. That shield protects us from being cooked by the sun, being irradiated. But the human bodies are the same. Human bodies produce their own magnetic fields. Every atom has a magnetic field. Atom, down at the atom level. And we have 70 trillion cells in our bodies. So imagine the amount of magnetic field that a body can produce. Some people would call that the aura.
Yeah, exactly.
It goes beyond the concept of the aura, but basically, I think the part of what the aura is in fact the magnetic field of the body. We have instruments today that can detect the magnetic fields of the brain and the heart. But every organ, every tissue has its own sort of electromagnetic signature, right? And you can actually resonate with those signatures within the body to produce healing effects.
Yeah.
So again, it's all part of a cosmic sort of plan, if you will, to have a contained system. You know, one of my background experiences is to study acupuncture. And I discovered in my journey in learning acupuncture is that even watermelons have acupuncture points and meridians.
Yeah.
So it's not a human phenomenon.
No, it's a general phenomenon.
It's a general phenomenon. Any organized biology, any organized life has in a sense, a physics around it that sort of contains and controls and modifies and moves and shapes everything inside it. So the magnetosphere is no different than basically the energy envelope of the body.
Yeah. So when you have that energy field in every body part, in every cell, then how is that induced or how is that increased? Because that was one of the questions that I was speaking to Michael about. when we charge, and that's what we call it, it's like a battery charge, and we charge, but he says it's more the movement, it's more the vibrational energy that then is passed over the energy into the cell.
Well, Faraday's law,
Yeah.
okay, basic physics. When you have charge, or when you have conductors, and you have a magnetic field moving past the conductor, sweeping in and out past the conductor, you create charge.
It's like those toothbrushes that you put in that don't have a connection, but they're still charged.
They're still charged.
Exactly.
But you have to have motion. That's the key. You have to have motion. Now, static magnets work relative to the body only because the body's in motion.
Yeah, exactly.
All right, but if you have a dynamic magnetic field, pulse magnetic field moving in and out through a body, and you have the activity of the body itself, whether it's a circulation or the pulsation of nerves or the normal biological metabolic activity, 70 trillion cells in the body, there are over 2,000 biochemical processes happening per second in every cell. That's a lot of motion. Right? And it's a lot easier to move something that's already in motion than it is to start something moving in the first place. First law of thermodynamics.
Yeah.
Right?
So when you think about what you just said, the energy that is produced in the body and that you pulse into the body, that brings us to those two questions. There is one which is based on frequency, and that's what we all talk about, the earth frequency, starting at 0, going up to about 30 to 60 hertz.
50, yeah.
50 hertz, which is that vibrational energy, and that's in the earth magnetic field parallel at many times. So there is not just one frequency at a time, because we have so many layers of density, there is many frequencies at the same time. And they stimulate the body, they stimulate the cells, and we know certain organs have a frequency pattern. They listen or they respond to certain frequencies more or less.
Well, again, everything is resonant.
Yes.
So resonance is frequency. Everything. And so what we're trying to do then is in pathologic processes, the resonance patterns, the energy patterns are not correct. They're not normal in a sense. And so what you're trying to do is you can either match the pathologic process or you can match the actual process of a normal organ or normal cells.
Yes.
So if you create an environment where the cells are supposed to resonate at a particular frequency, you create an environment with that frequency, then the body begins to frequency follow.
That's what we call a healing environment.
That's a healing environment, exactly. So you're trying to match these things, but it's even more complicated than that. Remember we said that in order to create charge, you have to have a moving magnetic field. Well, as the magnetic field moves towards an object, it's almost like a Doppler effect. It moves towards the object, the field intensifies, the reaction intensifies, and it moves away past the object, the reaction decreases. So you get this sweeping action, it's almost like waves, back and forth and back and forth. So you need the gradient, you need the motion through it, you need the frequency, and you need the right intensity.
Yeah.
So you need all those elements to be able to produce the right actions. And PEMFs have most of those characteristics.
Yeah.
But there's also a phenomenon called harmonics.
Yeah.
So when I introduce one frequency into the body will then take that one frequency, and through a process of the way it reacts to that frequency, you'll create all these harmonics.
Yeah.
And so when you do a stimulation now, the harmonics play themselves out over hours or days even, depending on the tissue. Again, some tissues are moving at extremely slow rates, and some tissues are moving at extremely rapid rates. So those harmonics can play out in a couple of minutes, or they can play out in days or weeks even.
Yeah. So when you talk about those harmonics, that's what we then talk about, the frequencies.
Which is the
put into
frequencies.
body.
Which is the frequency.
Whereas if we talk about those ringer devices that send pulses into the body, that's more like we ring a bell.
Yes, right. And so that's all PEMFs basically are frequency based. Now again, you talk about ringers and hummers.
Exactly. Yes.
Okay, so a ringer, I think the fundamental value of a ringer is the fact that you create this very large, sudden increase in energy, the Faraday effect. You're creating this huge pulse of energy, and that generates charge, because you're moving, this field moves up very rapidly, very high, very quickly, and that causes the production of charge
Yeah.
in the cells in the body. When you introduce charge, what's charge? One main element of charge is ATP.
Yeah.
So what's ATP is the energy, is the molecule inside the cell produced by the mitochondria that is used as a sugar, if you will, right, by the cells to do their work. If you're depleted in ATP, your cells are depleted. They don't function. They function very slowly, right? As opposed to eating and doing the job properly where it's supposed to.
So by inducing that energy, whether through oscillating or whether through the ringer device, it doesn't really matter. It's that energy increase in the cell, and that's what we see in the dark field microscope, that they all start to inflate and to energize, move a lot quicker.
And the problem is matching the type of PEMF that you're using for the problem. And every PEMF is going to provide some benefit to the body.
Yeah.
But it's not necessarily going to provide the benefit you want.
Yeah.
In the time frames that you want. So you could produce a lot more charge a lot more quickly with a ringer temporarily, but it doesn't have the frequencies. So the body then has to produce the frequencies and the reactions, and the body sort of takes care of business on its own after that. On the other hand, you can use very low intensity frequency systems, whether it's a single frequency or complex frequencies, and it doesn't produce as much energy, but it plays out over a longer period of time. So you can do more sustained work with PEMFs that are lower intensity and multiple frequencies over periods of time. So we have devices, for example, that do the ringer type of approach. One of them is the PEMF 120, or the Regenitron, which is a new one that's being introduced. On the other hand, you use other ones that you can carry, put in your pocket, like the Flex Pulse. So that produces a frequency that's lower intensity, but it has multiple frequencies, and so you can actually then carry it around with you, and it takes longer to produce the results that you want.
Yeah, which is why you can see mostly in clinics, when they want therapeutic effects, they use those ringer devices to get an instant result, to pull through more patients before treatment, after treatment, to get the effects.
Right.
Whereas as a ongoing treatment, as a well-being treatment, pain treatment, regeneration and rejuvenation program, the oscillating programs are more
sustaining and maintaining. Exactly. Now they're therapeutic too, but they do more maintenance and sustainment. So the best approach would be to have multiple devices if you could afford it.
Exactly, always.
Right? But if you can only afford one, then, as you said, you can start with getting things really moving with a higher intensity ringer type devices and maintain the progress then with the other lower intensity systems.
Which is actually one of the points of the blue device here, which allows the ringer in one side as a pulse, and then having the sweep frequencies on top of that, which then allows to have that oscillating frequency at the same time.
Correct. Yeah. So this blue type device has built into it the capacity to have a ringer spike, if you will, and then there's a rest between spikes. So you have to decide how much of a rest time you have. Well, that's in a sense wasted time. It's not wasted, because it's never completely wasted, but it's sort of idle time. It's still, motor's still running, but it's idling. And so what you can do is you can take that idle time and make it work. But you're giving the body different information in that idle time, which the body will use in other ways.
As you just explain it, it jumps to my mind, it's like music. You have the drummer who gives the beat, and then in between is the piano that plays very nicely.
Right, or the violin, or exactly.
Very nice. Now, would we just switch over in regards to cancer? My audience is all about cancer, and that's our main subject, degenerative diseases. How you see the influence in those devices with that disease?
Well, as we know, cancer is a systemic condition, okay, and it's a chronic condition. It's not just you get rid of your tumor and you got rid of your cancer, right?
Unfortunately not.
Unfortunately, and I wish it were so. So you can never treat cancer in isolation. It has to be treated in the context of a complete environment. And if I got a big toe that's hurting me because I got gout or something, or I banged my toe or broke it or something, well, all of that's going to affect the rest of the body. And if I have cancer growing in the body, then the cancer is going to be affected by my big toe.
Oh, certainly.
So you have to take care of the whole body. And so the magnetic fields are basically doing both. You know, they're helping with the individual cancer, but they're basically helping with the whole body. So you can start like with the ringer concept idea. You start with the ringer, but then you add the other aspects, the harmonics. So you can do both. Now, so magnetic therapy can impact the cancer directly, the solid tumor directly.
Exactly. Yeah.
But what you want to do in the long run, that's the short run. In the long run, what you want to do is to have a better, healthier body in general. Let me give you another example, another concept. If you have 70 trillion cells in your body and your left little toe decides to get a hangnail, how many cells have to be damaged before you're even aware that you have a hangnail growing?
Yeah, millions.
Millions.
Yeah.
Right, millions. Beyond your awareness. You're not aware of it.
Yeah.
But if you're doing magnetic therapy on a regular basis for maintenance purposes, then you're taking care of business before you even get the hangnail.
Exactly, yes. Yeah.
Right? So what other conditions are going on in our body that need attention that you're not even aware of? And yet they're a drain on you. And if you have more than 1 or 2 or 5 or 10, then all of that starts to become cumulative and adds to the total burden.
I found that always fascinating. One lady, during the workshop, we had the dark field microscope set up, and we pricked her finger, and then she had PEMF treatment in her tummy, and then we took the blood from the finger again. She said, why did that change if you had the treatment down here? And it's like, it's always a systemic treatment.
It's completely
especially
systemic.
with PEMF, because it penetrates. Like if you look, you don't have the mats here, are they here? So if you have the penetration, it goes, 2, 3, 4 meters, you can measure the value or even more very clearly. So it really penetrates the whole body.
It goes right on through. The body is transparent to magnetic fields. This is different than electrical stimulation. Electrical stimulation, like with TENS, T-E-N-S pads, doesn't penetrate very deep because the fluid, the saline in the body and the resistance of the cells dissipates that energy. In addition to that, it tends to go where it wants to go. You can't focus it and direct it.
It's very difficult, They use that with galvanotherapy.
Exactly.
But it's very targeted, small area.
Tar and superficial, typically, right? Or if you want to go deeper, you have to increase you may have to do surgery, but you have to increase the electrical field. And when you do that, you start killing cells. All right,
so there's in Hanover, they have internal surgical procedures for the tumor, for prostate cancer, and actually place needles into the tumor in positive and negative, and through that kill it with current.
And you can do that, but that's invasive.
Yeah,
so
certainly, very invasive.
Can you do that without being invasive? And the answer is with PEMFs, you can. Because the PEMFs that we use are not what we call radio frequency, or they're not microwave level fields. Microwave fields are very, very short wavelengths. They don't go through the body. And so as a result, they will tend to be absorbed by the body. That creates heat, which creates damage. This is why we want to avoid these kinds of PEMFs or EMFs as much as we can. So I make a distinction between the sort of bad EMFs and the therapeutic EMFs, because most of the bad EMFs are actually not long wavelengths. So we call them low frequency EMFs. They're not usually harmful to the body. It's rare that they are. But the other ones with very short wavelengths can be harmful. They can cause cancers. They can be used therapeutically too. We actually use them therapeutically.
Well, it's something that I always think, when you look at the spectrum, you start at a low frequency and they're usually tolerated by the body over a long period. And the higher we go, the shorter the period time. It's like far infrared. You don't want to use far infrared for hours because it becomes detrimental. Whereas if you use it for 1 or 2 hours to heat up and to use the fever, it's very beneficial. Laser light, you don't want to burn yourself non-stop with laser light, but if you use it short time, so the higher we go up, the shorter the exposure time to actually have a beneficial effect.
That's correct. And with low intensity, low frequency PEMFs, you can have extended exposures 24/7. Because there's some, if water's flooding the road and you put a barrier up, you have to maintain the barrier until the water level goes down. If you don't maintain the barrier, the water will reflood the road. Well, PEMFs do the same thing. So sometimes you'll see a benefit today, in a few minutes even, with PEMFs. But if you take the PEMF away, the pain comes back because you have not resolved the cause. Right? So the intention is not only to make you symptomatically better, reduce your pain level, but you also want to begin to affect the cause. get rid of the reason.
And I think that's where all of the PEMF devices are very powerful, because they increase oxygen uptake, they increase nutrient uptake, and they help with detoxification and restoring the balance within the
Balance,
body.
key.
Yeah.
Key. It's all part of balance. And the nice thing about PEMFs is they don't generally affect the low frequency, low intensity PEMFs. They don't generally affect healthy cells. It's like you and I having a conversation. If we're having a conversation, you can start tune out and go somewhere else in your mind, right, while I'm talking. So you can decide whether you want to pay attention or not.
Yeah.
But a sick cell, if you got extreme sensitivity, then even a whisper would be something that's going to affect you. So sick cells are cells that are affected strongly by whispers, and they need the energy. So magnetic fields, going back to charge, they need the energy to finish the healing job.
Yeah.
And we see this in devices that have been approved by the US government, the FDA, for healing fractures that don't finish the job of healing. They're called non-unions.
Yeah.
And when you supply magnetic fields to those fractures, even though the fracture's been there that way for 5 years, all of a sudden you kickstart the healing process, and the body finishes the job.
Yeah, exactly. Well, that's why those devices are also very well known as extremely beneficial for ligament, bone health, wound healing, oxygenation, which is part of the healing process. So it's really affecting all of those.
But they take time.
Yeah.
Every tissue has its own cycles of regeneration.
Oh, certainly.
Right? That's why we say we're a new person every 7 years. Well, actually, our eyes are new every 24 hours. Our gut cells are new about every 3 days. And the skin is new about every couple weeks. Whereas bone takes up to 7 years to be renewed.
Yeah.
So you have to allow for not only understanding how much damage there is that you're trying to shift and repair and recover, but you also have to know what the metabolic rate of that particular tissue is.
And the next issue is when you have all your cells divide, so they pass on the present state of their knowledge, the DNA right now, to the new cells. So it's not that they repair and become completely new, but if you add that balance and that regeneration and a proper ATP production, then we have also an increased repair of the DNA. And Dr. Rao explained that redifferentiation of cells, which means we turn them from sick, inflamed cells slowly back into a healthy cell.
Into a healthy cell. And the sick cells, if you can't grow a garden in a swamp.
Yeah.
So if you clear the swamp, now you can grow a garden. So if you want to replace the cells that have died in the illness process or disease process, then what you're doing is, as those cells get replaced, they get replaced by healthy cells in a healthy environment.
Yeah, exactly.
Right? If you try to get a healthy cell to go into a sick environment, of course, you're trying to grow a plant that needs the proper lighting and the proper hydration, well, it's not going to work.
Yeah. We have a lot of people that ask, how often can I use it? How often is it advisable? Does my body get dependent? And I think we spoke about that yesterday about a point. So I'd like to give you an answer, or you give an answer for that.
It's not like creating the artificial dependence of a narcotic.
Yeah.
Or, like Valium or something like that. It's not that kind of dependence, where you're replacing the natural functions of the body, and now the body needs what you're giving it, and you can only maintain it in that state as long as you keep supplying that nutrient.
Yeah.
Well, magnetic fields, once the body's done, you can take them away. Mm-hmm. But again, we started at the very beginning saying that our bodies are deficient anyway.
Yeah. Yeah.
Right? So really you can use it forever, and you're not dependent. But clearing the road idea again, if there's a flood coming, put a barrier up so it won't keep swelling over into the road. So you will maintain it as long as you need to maintain it. That's not dependence.
Yeah.
It's dependence only not in a negative sense, it's dependence in a positive sense, that you're maintaining a higher level of functioning by maintaining the use of the treatment.
Yeah.
Now, let's also remember that as we get older, we don't have the repair capacity that we had when we were young.
And the energy and the build-up capacity.
Exactly. So in a sense, we do become more dependent as we get older.
Yeah.
Now, we may expect to live to 70 or 80 or 90. I mean, I know people who turn 85 and say, I'm out of here.
Yeah.
I don't want to stay here anymore. All the reasons I'm here as a human being are gone. All my family's gone, all my friends are gone. I'm done. So if we're not done, but we're at a point where we're too decrepit, and we need a lot of help to keep going.
And like something that I experience, people when they start using the device, it's not like that you feel it it can, depending if you have pain, if you lack energy, if the right composure is there, you feel an instant change. But what I realize more is people, when they stop using it, they realize a lot more than when they started to use it.
You do get used to the new state.
Yeah, exactly.
Right? When you're sick, you know what you feel like when you're sick, and you don't want to be there. But when you're well, you kind of forget about what it was like to be sick.
Exactly. Yeah, and that's when my mother-in-law, when she stopped using it, she went away for a holiday. She was desperate to come home to her device.
I learned this very early on. I've been doing magnetic field therapies for 25 years.
Yeah.
I learned this very early on with a guy who was having leg cramps.
Okay.
And but he didn't have them every day, and he didn't have them 3 or 4 times a night. He had them now and then. So we got him on a magnetic therapy system, and he says, I don't know if it's working. I still get them occasionally, but maybe they reduced by 50%, but he still got them. So in his mind, because he's still getting them, we hadn't finished the job. He did what you said about your mother. He went away, left his magnetic system. And the increase in cramping went up dramatically. Yeah. Then he realized.
And the example that you bring is really important, because that shows that it's not a general cure, because you still need magnesium to reduce the cramping, and if you have deficiencies in the body, that's not just something that's going to wipe the deficiency away, it's just helping with the body processes. You still need to look at all the other things.
Well, and if let's say you're a weightlifter.
Yeah.
Right?
Yeah.
Let's say you're bench pressing 300 pounds. Right. What if you stop bench pressing for 300 pounds? Go away for a month and don't do anything. Can you go back right away to do 300 pounds? Probably not. Yeah. Most likely you're going to have to drop back to a different weight level to rebuild the capacity to get to that new level. Our bodies are no different. Those processes that we give them the extra juice, right, to do what they can do, and that's where we want to be, then you have to keep using it in order to maintain yourself at that level.
Yeah. Can you talk a little bit about inflammation and PEMF? Because this is an important one. We know that inflammation is one of the main contributors to cancer, or one of the main problems caused by cancer. So how would that influence?
Well, there's two kinds of inflammation, fundamentally. There's acute inflammation, which is absolutely necessary for life.
Yes.
If you cut yourself, you better have a good repair response, and that's acute inflammation. Now, acute inflammation can be proper or it can be dramatic. In other words, it can be out of balance as well, and so you can assist acute inflammation with PEMFs, and that's where you see the most dramatic results right away. My wife, for example, broke her little toe, and she started a PEMF system after she broke her toe, and we did the proper splinting and so on to maintain the fracture site. She used her PEMF 24 hours a day. So after breaking it like midday, she used it constantly till the next morning. All the bruising was gone, all the swelling was gone. Yeah. Right? She used it continuously for the next 24 hours. That next day, she walked 1 mile in a tennis shoe. Yeah. The day after that, with continuous use, the day after that, she walked 3 miles in a tennis shoe. Yeah. She needed to be using the magnetic therapy acutely in that short-term situation, constantly, in order to have the healing time dramatically reduced. Normally, if you break a little toe, it takes weeks for you to be able to hobble around normally, relatively normally again.
Dr. Finn Scott Anderson in Denmark made actually a lot of research studies in healing, wound healing and repair, and the times that it decreased was usually 50%.
About 50%.
60%, yeah.
Yes, that's correct. And then the other kind of inflammation, to go back to the question you asked, the other inflammation is chronic, and that's the inflammation that's present in chronic disease. Yeah. Okay, and what happens is the body, when it finishes the job of acute inflammation, it doesn't stop. Yeah. So the environment somehow does not allow the acute inflammatory cells to go away somewhere else and do what they're supposed to do elsewhere in the body. They stay there and they continue to create inflammation. So that's chronic inflammation. Yeah. And what PEMFs do is they change the environment, the whole local environment. They change it from acidic to alkaline. They bring in more nutrients, as you mentioned. They rebalance the ions, they rebalance the chemistry of the cell, they stimulate RNA and DNA, they add more ATP. So all of these other aspects of PEMFs condition the environment to be healthier. Then the chronic inflammation can often go away. But there's another important aspect with longer term use of PEMFs is that it causes the chronic inflammatory cells to die off.
Yeah.
It's called apoptosis. Okay, so apoptosis is the natural process of the body. Old cells die, that's called apoptosis, and they're replaced by the healthy cells. So you cause these chronic inflammatory cells to die off faster, and that decreases the chronic inflammation, but that takes time.
Yeah. But the increase of apoptosis or redifferentiation of cell, that's actually the main effect to reverse inflammation.
Chronic inflammation.
In hip joints, I have clients with massive hip problems or osteoarthritis, inflammation by viral infections. And what I found, this was for me the biggest thing, when you use it, all of a sudden the white blood cells really triple in size. You see the nuclei full on active, and that already shows that they then take care of microbes and viral infections.
If you give the body, I'll give you another example. What's the value of an antibiotic? All it does, we have a misconception about what antibiotics do. All they do is to kill the bacteria. What helps the damage caused by the bacterial infection? Nothing that the medicine does. Nothing that medicine does. So what PEMFs do in that setting is you still might need the antibiotic, whether it's natural or synthetic. But then what you're doing is you're facilitating the body's repair process, the process of actually healing itself. So when you leave a typical doctor's office, they give you the antibiotic, and in their minds, the doctors cross their fingers that your body will take care of business.
Yeah, exactly.
Right?
Yeah.
But that's not finishing the job. A natural medicine doctor is going to say, okay, we need the antibiotic to take care of the acute situation and the severity of it, but now we also need to finish the job by giving you andrographis, you need to echinacea, or whatever you need to do to stimulate the immune system. But then you add more nutrients into the system, you add more alkalinity into the system, you add more vitamin D into the system, right? All of that helps the body to finish the job and minimize the level of damage that's present.
Yeah. I had yesterday at one of the workshops upstairs, they explained the DNA repair and how that actually happens all the time as soon as you remove toxins. And that's one of the effects that we have too, so it really starts to...
The toxins turn off the DNA, the repair processes, and then when you remove the toxins, the body does what it's supposed to do.
Exactly.
Right.
Perfect. Thank you very much for that. That was
you're welcome.
Really insightful. Do you have something that I forgot to ask that you would like to share with the world?
Oh, I thought that was pretty comprehensive. Thank you.
Yeah, good.
I appreciate the work you're doing. I think you're doing an incredibly laudable work. And you know, I'm resonant with you, to go back to the PEMF analogy, which is that we really have to understand that when we're treating cancer, it has to be done in a holistic fashion, and that chemotherapy or surgery or radiation can be a piece of a program. And I don't think we can take a judgment on what an individual decides is the best, because cancer is so complex, and there's so many different types of cancers that respond better to one thing or another. And that complexity, there's no simple solution to this. And you have to be reasonably skilled at this and knowledgeable in so many aspects of healthcare.
That's exactly what Truly Heal is about. Like we've covered like the whole range of subjects, and we pull all the pieces together so that it becomes a team. It becomes a holistic process, and not just pieces of the puzzle.
My words
Good.
are echoing your words.